One pill a day to boost your testosterone, no injections. Have you ever felt that your energy is no longer the same? That the willingness to face the day, to train, or even for intimate moments has drastically decreased? What if I told you that there is a way to increase your testosterone levels without the need for injections or hormone replacement? Many men suffer from a drop in testosterone without even realizing it. Constant fatigue, difficulty gaining muscle mass, lack of concentration, and even a drop in libido can be signs that your hormones aren't working in your favor. But is there a solution that actually works without harming your natural testosterone production? In this video, we'll unravel everything you need to know about clomiphene citrate, how it works, what its benefits are, the risks involved, and how to use it safely for the best results. Let's get started. What causes a drop in testosterone in men? Testosterone is the primary male hormone and plays a key role in energy, strength, libido, and overall well-being. However, over the years, many men begin to notice a drop in their hormone levels without understanding exactly why. Aging is one of the main factors responsible for this reduction. From the age of 30, testosterone levels begin to drop gradually, on average 1% per year. Although it seems little, this continuous decrease can lead to symptoms such as fatigue, loss of muscle mass, fat accumulation, and a drop in libido over time. But aging is not the only culprit. Modern lifestyle has accelerated this decline in a worrying way. A sedentary lifestyle, for example, is a great enemy of the natural production of testosterone. The lack of physical exercise reduces the activation of muscles and, consequently, decreases the hormonal signaling responsible for the production of this hormone. Poor diet also plays a critical role. Diets rich in refined sugars, trans fats, and ultra-processed foods can increase inflammation levels in the body and favor the accumulation of visceral fat. This type of fat is especially dangerous because it converts testosterone into estrogen, further aggravating the problem. Chronic stress is another factor that can bring down your hormone levels. When the body is constantly under pressure, it releases large amounts of cortisol, a hormone that inhibits testosterone production. This effect is even worse when combined with sleepless nights. Sleep deprivation reduces the production of anabolic hormones and impairs muscle regeneration, two essential processes for keeping testosterone at adequate levels. In addition, some health conditions such as obesity, type 2 diabetes, and insulin resistance are directly linked to the drop in testosterone. Excess body weight disrupts metabolism and negatively affects hormonal balance, creating a vicious cycle that is difficult to reverse without significant lifestyle changes. Now that you know what may be causing your testosterone to drop, the question that remains is it possible to increase your hormone levels without artificial replacement? It is possible to increase testosterone without hormone replacement. Many men believe that the only way to recover their testosterone levels is through hormone replacement with injections or gels. However, this is not the only option. In many cases, it is possible to stimulate the body itself to produce more testosterone in a natural way without compromising the functioning of the hormonal axis. The first step to increasing testosterone without replacement is to eliminate the factors that hinder its production. This means improving your diet, exercising regularly, and reducing stress. Small lifestyle changes can make a big difference in hormone levels and quality of life. Bodybuilding, for example, is one of the most powerful tools for stimulating the natural production of testosterone. High-intensity exercises, such as weightlifting and compound training, squats, deadlifts, bench presses, activate the production of the hormone significantly. Training regularly and at an appropriate intensity can help reverse the drop in testosterone without the need for medications. Another essential factor is the quality of sleep. During deep sleep, especially in the REM phase, the body produces most of the testosterone. Men who sleep less than 6 hours a night can experience a drastic reduction in levels of this hormone. Establishing a proper sleep routine and avoiding blue light from screens before bed are key strategies to optimize hormone production. Food also plays a crucial role. The inclusion of healthy fats, such as those found in olive oil, avocados, nuts, and eggs, helps provide the nutrients needed for testosterone synthesis. In addition, adequate intake of zinc and magnesium is essential, as these minerals are directly involved in hormone production. But what about when these lifestyle changes aren't enough? Is there an alternative to stimulate testosterone safely and effectively? Enter clomiphene citrate, a drug that can help boost natural testosterone production without compromising hormonal balance. In the next topic, we will understand how this solution works in your body and why it has been increasingly used by doctors around the world. What happens to your body when your testosterone is low? Testosterone is a fundamental hormone for several functions of the male body. When your levels are adequate, you feel more energy, strength, sex drive, and motivation. However, when testosterone starts to drop, the body gives clear signals that something is not right. One of the first changes that occur is the loss of disposition. Men with low testosterone levels often report extreme tiredness, even after a full night's sleep. Lack of energy can affect both physical performance and productivity at work and quality of life on a daily basis. Body composition also undergoes major changes. Testosterone plays an essential role in the growth and maintenance of muscle mass. When its levels drop, the body's ability to build muscle decreases, while the accumulation of fat, especially in the abdominal region, becomes more evident. This change is not only aesthetic, but also impacts metabolic health, increasing the risk of diabetes and cardiovascular disease. Another worrisome symptom of low testosterone is decreased libido and sexual function. Testosterone is the main hormone responsible for male sexual desire, and its deficiency can lead to reduced interest in sex and even erectile dysfunction. This can affect self-esteem, confidence, and even relationships. In addition to the physical effects, the drop in testosterone also impacts the mind. Many men with low hormone levels report difficulty concentrating, memory lapses, and even symptoms of depression and anxiety. This is because testosterone is directly linked to the production of neurotransmitters responsible for well-being, such as dopamine and serotonin. Over time, if this deficiency is left untreated, symptoms can intensify and further compromise quality of life. But can ignoring this problem have even more serious consequences? In the next topic, we'll explore the risks of not treating testosterone deficiency and how it can affect your long-term health. What are the consequences of not treating testosterone deficiency? Ignoring the drop in testosterone may seem harmless at first, but over time, the negative effects accumulate and can profoundly impact your physical and mental health. If symptoms are already appearing and nothing is done, the consequences can be even more serious. One of the first complications of untreated testosterone deficiency is the progressive loss of muscle mass. Testosterone is essential for maintaining muscle strength and endurance, and its prolonged drop leads to sarcopenia, which is the reduction of lean mass. This means less strength, more difficulty performing physical activities, and even a higher risk of injury. In addition, the accumulation of body fat, especially in the abdominal region, can become a serious problem. The increase in visceral fat is directly linked to diseases such as type 2 diabetes, insulin resistance, and high blood pressure. This creates a domino effect that negatively affects metabolism and increases the chances of developing cardiovascular problems, such as heart attacks and strokes. Another major impact is on mental health. Testosterone deficiency can trigger or worsen depression and anxiety. This is because the hormone is involved in the regulation of neurotransmitters responsible for well-being, such as dopamine and serotonin. Men with low testosterone levels often report demotivation, lack of interest in activities they once enjoyed, and even a constant feeling of mental fatigue. Problems also affect sex life. In the long run, low testosterone can lead to a severe decrease in libido and a worsening of the quality of erections, affecting intimate life and self-esteem. In some cases, it can even compromise fertility, since testosterone is directly linked to sperm production. If nothing is done, the quality of life can drop dramatically. But what if there was a way to reverse this situation without needing injections or traditional hormone replacement? In the next topic, we will talk about the signals that the body gives when testosterone is low, and how to identify this problem before it causes irreversible damage. Your body is warning you. The signs of low testosterone that you can't ignore. Your body talks to you all the time, but are you listening? The drop in testosterone does not happen overnight, and the signs appear gradually, often being ignored or attributed to stress, fatigue, or even age. However, recognizing these symptoms can be the key to taking action before the problem becomes even bigger. The first alert comes from your energy. If you feel constant tiredness, even after a good night's sleep, and notice that your day-to-day disposition has dropped dramatically, it may be a clear sign that your testosterone levels are low. Unexplained fatigue is one of the most common symptoms of hormone deficiency. Another striking symptom is the difficulty in gaining muscle mass and the loss of strength in training. If even with a good diet and proper training, your muscles don't seem to respond as before, it may be an indication that your testosterone is not at the ideal level. In addition, the accumulation of fat in the abdominal region, even without major changes in the diet, can be a direct reflection of this deficiency. Your mind also feels the effects of low testosterone. Difficulty concentrating, memory lapses, and even a feeling of demotivation can be linked to a lack of this hormone. Some men report that they lose the desire to challenge themselves, to seek new goals, and even to socialize. And we cannot forget the impact on sex life. Testosterone is the main hormone linked to sex drive and male performance. The drop in libido, the difficulty in maintaining erections, and even the feeling of less sensitivity during the act are clear signs that something is not right. If you have identified with these symptoms, it is time to pay attention to your body. But before thinking about solutions, it's important to understand what may be preventing you from increasing your testosterone naturally. In the next topic, we'll talk about the big mistake many men make when trying to recover their hormone levels and how to avoid it. The big mistake many men make when trying to increase testosterone. When a man discovers that his testosterone levels are low, the first reaction is usually to seek a quick fix. Many believe that the only way to recover testosterone is through direct hormone replacement with injections or gels. However, this choice can be a big mistake, especially for those who still produce the hormone naturally. What many don't know is that artificial replacement can disrupt the body's own natural production of testosterone. The body works in a delicate balance. When external testosterone enters the bloodstream, the brain understands that there is already enough and reduces the production of the hormone. Over time, the testicles can atrophy and natural production becomes increasingly compromised. Another common mistake is the indiscriminate use of substances without medical supervision. Some people turn to anabolic steroids without knowing the risks involved, such as liver changes, increased blood pressure, gynecomastia, growth of the mammary glands in men, and even infertility. Additionally, stopping the use of these substances without a proper protocol can lead to serious side effects, including depression and extreme loss of libido. There are also those who believe that just changing their diet or training hard in the gym will be enough to recover testosterone. Although these strategies are fundamental for hormonal health, in some cases they are not enough to reverse the condition. This happens especially when the problem is in the hormonal axis. That is, when the brain is not sending the correct signals for the testicles to produce more testosterone. So, if direct replacement can be risky and lifestyle changes aren't always enough, what's the solution? In the next topic, we'll talk about a safe and effective alternative that can stimulate natural testosterone production without compromising your body's balance. Clomiphene citrate, the solution that stimulates your body to produce more testosterone naturally. If you could increase your testosterone without needing injections, without stopping its natural production, and without taking the risks of traditional hormone replacement, would you consider this option? The good news is that such a solution exists. Clomiphene citrate is a drug originally developed to treat female infertility, but over the years it has shown amazing results in raising testosterone levels in men. Unlike direct hormone replacement, it does not deliver testosterone to the body, but rather stimulates your body to produce more of this hormone naturally. The secret lies in the way clomiphene citrate acts on the hormonal axis. Normally, when testosterone levels rise, the brain reduces the release of luteinizing hormone, LH, which is responsible for stimulating the testicles to produce more testosterone. However, clomiphene citrate interferes with this process, preventing the brain from realizing that there is already enough testosterone in the body. This causes it to continue producing LH, which in turn keeps the testicles active and producing more testosterone naturally. This approach has a major advantage over traditional replacement. It does not turn off the natural production of the hormone. Instead, it strengthens the functioning of the body's own hormonal system, helping to regain testosterone levels without the risks of testicular atrophy or infertility, which can occur with direct replacement. In addition, clomiphene citrate can be an ally for younger men who are experiencing the symptoms of low testosterone but who still want to preserve their fertility. As it does not negatively interfere with sperm production, it can be a safer alternative for those looking for hormonal balance without compromising reproductive capacity. But what are the real benefits of this medication, and what can men expect when using it? In the next topic, we will explore the positive effects of clomiphene citrate and how it can transform your mood, libido, and performance on a daily basis. The power of clomiphene citrate, the secret that many doctors don't tell you. Clomiphene citrate has been a real game changer in the treatment of low testosterone, but many men are still unaware of its potential. Unlike traditional hormone replacement, this medication has the ability to stimulate the body itself to produce more testosterone without shutting down the hormonal axis. But what makes clomiphene citrate so special? The answer lies in its mechanism of action. It works by blocking estrogen receptors in the pituitary gland, preventing the brain from noticing that there are sufficient levels of testosterone in the blood. This forces the body to continue producing more luteinizing hormone, LH, and follicle-stimulating hormone, FSH, which in turn stimulate the testicles to increase the natural production of testosterone and sperm. In this way, in addition to improving hormone levels, clomiphene citrate can also contribute to male fertility. This is a great differential in relation to traditional hormone replacement, which can compromise sperm production and reduce the chances of having children in the future. Another little discussed point is that clomiphene citrate can bring benefits beyond increased testosterone. Men who use this medication report a significant improvement in mood, muscle recovery, and even mood. Since testosterone plays an important role in the regulation of neurotransmitters, its increase can positively impact motivation, concentration, and even the feeling of well-being. Additionally, there is evidence that clomiphene citrate can help balance the ratio of testosterone to estrogen in the body, preventing unwanted side effects such as fluid retention and excessive fat gain. But if this drug has so many benefits, why is it not yet widely indicated? The answer may lie in the lack of knowledge about its use and the myths surrounding its long-term effect. In the next topic, we will talk about the real benefits that men can get from using clomiphene citrate and how it can transform their hormonal health in a safe and effective way. Energy, desire, and performance. The incredible benefits of this simple solution. Testosterone balance is not just an aesthetic issue, but essential for energy, motivation, and well-being. When at adequate levels, it directly impacts your daily disposition, physical performance, and sex life. Clomiphene citrate can help increase testosterone, providing benefits such as more energy and vitality, reduces fatigue and improves muscle recovery, increasing your productivity, muscle mass gain and fat reduction, stimulates protein synthesis, improves response to workouts, and accelerates recovery, increased libido and sexual performance, improves desire, quality of erections, and pleasure during intercourse, improved mood and mental clarity, influences neurotransmitters such as dopamine and serotonin, reducing anxiety and improving concentration. But like any treatment, the use of clomiphene citrate can present risks. In the next topic, we will explore the possible side effects and how to minimize them for safe and effective use. Not everything is rosy, the risks you need to know before taking it. As promising as clomiphene citrate may seem for boosting testosterone naturally, it's important to remember that no treatment is without risk. Before starting to use this medication, it is essential to know the possible side effects and understand how to minimize the negative impacts. One of the main adverse effects reported is increased estrogen. Because clomiphene citrate stimulates the natural production of testosterone, some of this hormone can be converted into estrogen by the body. If this conversion is excessive, it can lead to symptoms such as fluid retention, breast tenderness, and, in rare cases, gynecomastia, growth of male breast tissue. To avoid this problem, it is essential to monitor hormone levels with periodic exams and, if necessary, adjust the dose or associate an aromatase inhibitor. Another possible side effect is related to vision. Some men report blurry vision or changes in light and color perception during prolonged use of clomiphene citrate. Although this symptom is rare and usually reversible, it is important to discontinue use if it occurs and seek medical advice immediately. In addition, there are reports of changes in mood and emotional sensitivity. Some people may experience irritability, anxiety, or mood swings, particularly in the first few weeks of treatment. This happens because hormonal balance directly influences the neurotransmitters responsible for emotions. Another point that deserves attention is the risk of thrombosis. Although there is no concrete evidence that clomiphene citrate significantly increases this risk, some research raises this concern, especially for men who are already predisposed to circulatory problems. Therefore, any unusual symptoms such as swelling, pain, or redness in the limbs should be evaluated by a professional. Finally, self-medication is one of the biggest risks. Without proper follow-up, it is easy to make a mistake in the dosage, ignore warning signs, or not perform the necessary tests to monitor the body's response. Now that you know the risks, how do you ensure that the use of clomiphene citrate is safe and effective? Dosage, correct use, and monitoring. How to avoid dangerous mistakes. Clomiphene citrate can be a great ally in increasing testosterone, but its use requires care. Inadequate dosage, lack of medical follow-up, and absence of periodic exams can compromise the results and even generate unwanted side effects. To ensure that this treatment is safe and effective, it is essential to follow some guidelines. The most commonly used dose to stimulate natural testosterone production in men ranges between 12.5 milligrams and 25 milligrams per day. The tablet available in pharmacies is usually 50 milligrams, which means that many patients need to split it to get the correct dosage. Some doctors recommend 12.5 milligrams every other day as a lighter starting dose, while others opt for 25 milligrams daily, depending on the body's response. Treatment is usually carried out in cycles of 3 to 6 months, which is enough to evaluate the effectiveness of the medication and monitor the effects on the body. During this time, it is essential to perform hormone tests regularly. The most important tests include total and free testosterone, luteinizing hormone LH, estradiol, estrogen, and prolactin. These tests help to understand how the body is reacting to the drug and if there is a need for adjustments in the dosage. Another important recommendation is to avoid prolonged use without breaks. Although some studies indicate safety in the use of clomiphene citrate for up to 7 years, most doctors prefer to evaluate the effects of the drug in cycles, ensuring that the body continues to respond well and avoiding possible adaptations that could reduce its effectiveness over time. In addition to laboratory monitoring, it is essential to be aware of the body's own signals. If there are symptoms such as changes in vision, changes in mood, or breast tenderness, it is necessary to adjust the protocol or, in some cases, suspend use. When administered well and monitored by a professional, clomiphene citrate can provide significant benefits without the risks of traditional hormone replacement. But at the end of the day, is it really worth betting on this treatment? Low testosterone can profoundly impact your energy, your mood, and even your self-esteem. But the good news is that you don't have to accept this reality as something inevitable. Science has advanced, and today there are safe and effective alternatives to restore your hormone levels without compromising your health. Clomiphene citrate is an example of how the right knowledge can transform lives. It can be the missing piece for you to regain your vitality, your physical performance, and your mental well-being. However, the secret to success lies in correct use, proper dosage, and professional monitoring. If you have been feeling the signs of a drop in testosterone, you now know that there are ways to reverse this situation. The decision to act is in your hands. Your body deserves attention, your health deserves care, and your quality of life should be a priority. Don't ignore the signs. See a doctor, do your exams, and find out the best strategy to optimize your testosterone safely and effectively. Your well-being and vitality depend on the choices you make today. So, How about taking the first step towards a better and more balanced version of yourself?